Hello, my name is Kim Lowmiller, and I will be presenting on the updated guidelines for the code neuro process in the emergency department. Emergency department procedures are ever-changing and evolving. One of the most important things that healthcare professionals can do is adapt and change in order to provide the best care possible for our patients. The goals of this lecture are that the learner will have a better understanding of the new code neuro process, be able to identify when a patient is having a stroke and call a code neuro, and they will also be able to take a lead role during a code neuro. After this lecture, the learner will demonstrate mastery of the code neuro process by scoring at least 80% or higher on the post quiz. They will be able to correctly simulate the code neuro process as evaluated through direct observation by the instructor. The learner will be able to properly manage the patient's glucose level and blood pressure as evaluated by verbal discussion with the instructor. And lastly, the learner will be able to evaluate the emergency department patient for the presence of stroke symptoms as evaluated by verbal discussion with the instructor. It is important that frequent education on the code neuro process is performed because more than 795,000 people in the United States have a stroke each year. In order to appropriately call a code neuro, we as healthcare providers need to be able to recognize the symptoms of a stroke. We need to be looking for patients that state that they have sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. We are also looking for anyone that states that they have sudden confusion, trouble speaking, or difficulty understanding speech, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance, lack of coordination, or a sudden severe headache. The graphic here is a great way to refresh yourself on the most frequent signs and symptoms of stroke. When starting with the code neuro process, it's important to have a checklist so that nothing is missed. Within the first 10 minutes of arrival, whether it be by EMS or if the patient walks in through the front door, we need to figure out the patient's last known well time, or when did the symptoms first start. If they started within the last 24 hours, then we can continue on with the code neuro process. Next, we need to check a blood sugar level. Hypoglycemia can present like neuro symptoms, so if the blood sugar is less than 50, then we need to treat with oral glucose or D50 and then reevaluate. Next, we need to establish at least one large bore IV in either AC. 2 IVs is preferable. Then we need to hook the patient up to a portable monitor and obtain a set of vital signs. It's important to remember that code neuro situations are typically all hands on deck, so a lot of the items on this list will get done simultaneously by various members of the team. All code neuro patients also need an actual weight in kilograms, just in case they are a tissue plasminogen activator candidate, or TPA. Next, we need to obtain lab work on the patient. Once we obtain a blood pressure, we also need to make sure that the pressure is below 180 systolic and 105 diastolic. If it is not, we need to discuss with the doctor about the administration of 10 milligrams IV hydralazine or about starting a nicardipine drip on the patient. Then we can roll the patient to CT to obtain a non-contrast CT to rule out a head bleed, and a CTA and a CTP. Within 30 minutes of arrival, the physician should be making the final decision about whether the patient is a TPA candidate. The nurse should be preparing the TPA so that it can be administered as soon as the doctor says that it's okay. Within 45 minutes of arrival, the physician needs to obtain consent for TPA if they are in the 3 to 4.5 hour window since the onset of symptoms. It is important to note that no consent is needed if it has been less than 3 hours since the onset of symptoms. The nurse will then administer the TPA bolus and begin the infusion. Remember, maintain strict MPO status on the patient until the swallow evaluation is complete. In conclusion, for every minute that a stroke goes untreated, up to 2 million neurons die. Therefore, timeliness is one of the most important aspects when dealing with a code neuro. Frequent practice and education can help reduce the amount of time from onset of symptoms to TPA administration. Thank you for your time.